Share mine. Hey, good afternoon, everybody. We'll be starting pretty soon here, so thanks for joining. Looks like we've got about 240 participants or so. So thanks a lot for joining this afternoon. We'll start in about one more minute. I want to make sure I've given folks a little time to get on. I do think we'll hit a maximum, we're just double checking that, of 300 participants. So if we run up against that and anyone's in a room where they can share, otherwise that might be a strategy anyway until we can address that later. Thank you. All right, I think we'll go ahead and get started. And I am watching the chat and hoping folks can hear. And I just love a thumbs up if you can hear. I can see a lot of smiling faces out there. So good. All right, good deal. Well, first of all, we're a little bit hasty or impromptu in this particular setup today. I think as I had shared yesterday, I was hoping to get another week of preparation time, and that's not happening for us, obviously. And so I figured it was best just to get started with a bit of a routine that I'm hoping to establish for communication. All of you I know have seen emails coming from the Department of Education, our dedicated web presence as well, that is available and will be a constant part of our effort to keep folks informed. Obviously, as we continue to address some of the unknowns and uncertainties around the coronavirus and spread, we want to just make sure that you know that we're in regular communication with a lot of different officials, and also try to establish a little bit of some protocols for continuing the conversations around the state. So I do very much appreciate everyone joining today. I'm going to share my screen because I want to talk a little bit actually from the website, just so you can be familiar with some of the resources that are there. I do have on the line Danette Smith, who is the CEO of the Department of Health and Human Services. I expect, or at least I expect him that he will be able to join us, but we'll see for certain. Dr. Gary Antone, who is the state's chief medical officer. As you know, given the work taking place, we'll try to continue to communicate well with our HHS partners. But I'll quickly start to share the website with you and talk through a few key points that I wanted to highlight. Let's see if this works anyway. So on the department's website and from the home site, you can actually get to the link for our coronavirus resources for schools. You will note that a lot of the resources are things that you're going to find from other providers or other information providers as well. Certainly, as this has gone across the country, the importance of listening and paying attention to the federal guidance that comes from the Centers for Disease Control and perhaps others as we continue to go. Certainly resources that are up there from other organizations, including the U.S. Department of Education at a federal level, and just partners as we keep going. You'll see that. You'll see resources there for students. We've had recent conversations with Health and Human Services officials about just communicating the non-pharmaceutical interventions that can take place, obviously hand washing and other things that you're quite familiar with. Pretty much anything, they believe anything that would stop the spread of flu will also stop the spread of the coronavirus. And so you can find resources on our website about that as well. There's some general information up there about coronavirus. One thing I think I want to highlight to you is as this is moving forward in Nebraska, we are getting questions about whether or not this is really that severe or what the impacts are. One of the purposes of the level of concern I think that's raised across not just across the state, but across the country is obviously the types of impacts that we're seeing for vulnerable populations, especially the elderly, and certainly the dynamics that we've seen in Washington state around nursing homes. That's an especially vulnerable population, but we have other vulnerable populations as well. And obviously we know in schools we may have vulnerable populations, both from a student perspective and from our employee perspective. And so becoming familiar with that, I think, is a really critical thing for everyone across the state to be doing. So we've tried to share some of that general information for you. We also have several Nebraska resources, and later when I am able to turn it over to CEO Smith, she can kind of walk you through a little bit of the update on that front. But we have our links to the HHS resources, and I'm probably in daily conversations with HHS officials about the importance of addressing this issue. You also see that UNMC is among the partners and the resources available to the state of Nebraska, and then further national resources are available there as well. One thing I wanted to highlight as we go is we'll continue to build a frequently asked questions guidance on the website, and we'll provide other guidance as we're able to identify questions to address and things that we need to have happen. So I want you to be able to also notice this contact form on this particular site. If you fill out this contact form, that's very similar to what we used during the flooding last year. It was very helpful for us to identify the types of questions and concerns folks have, so we can not just answer the questions you have specifically, but also to be able to help generate that frequently asked questions element as well. I don't anticipate I can answer all of your questions today. In fact, I think it might be a little bit difficult forum to be able to do that in immediately, but what I would love to be able to do, we'll monitor the chat room. You are welcome to send questions today to me directly. I might be able to catch some of those as the conversation goes on today to respond to some of those, but that'll also help us catalog and identify questions that we need to address in the coming days and weeks. So I start with that general introduction. I want to kind of go back to a little bit of where we've been over the last couple weeks, and I know we've shared information with you from the perspective of email sources. And it's we can only probably get out what we know, and you probably, like us, only know so much at a given point in time. Unfortunately, this weekend, once we identified our first case in Nebraska, that's obviously raised awareness for a lot of folks. I've been in touch with Mark Shepard at Fremont. Obviously, and things reported in the media for folks that are paying attention on that front, the concern and the reason to shut down in Fremont right now is mostly out of a great level of caution, just to hopefully be in a position that if there was any contamination from those events, that can be that can be addressed, and that it can be monitored for a period of time. What I know also from our health officials and from the communication standpoint, it's really critical that our school districts know their local health officials as best possible and deal with work with them and understand the kind of communication channels that are necessary. I know on our website you can actually find your if you don't happen to know your kind of health regions, you're able to sort through that. I see quite a few ESU folks, and thanks for joining today. I am planning to work with the ESU Coordinating Council to help establish a bit of a regional approach to communication. I was planning to be working on that this week and even before our first call, but we'll be coordinating with Craig Lofquist, who I think I saw at one point, and all the ESU leaders as well. I will be asking that, regardless of other protocols, that we try to and ensure that we're including all of our school community, so private and parochial schools, as well as public schools, as we continue to do that conversation. I think Fremont's a great example of when they knew something and how they acted and worked. And I offered to Mark Shepard to say a few words. I don't think he can be with us, or even if he is, he didn't want to say a few words necessarily today. Don't blame him. The reality for us, though, is that community level response is, I think, really important. And so the balancing act between what state responsibilities and local responsibilities kind of come together. And I think it's important that we continue to work on that together. I know there's a lot of student movement and student groups, and I just noted, I can see Jay Beller on my screen. So I know that NSAA and various activities are going on. We'll maintain contact with state partners and try to keep everyone in the loop as things continue to proceed in this case. So thanks again for being on in this setting. One thing, and I'll probably talk for about 2 more minutes, and I'll giving Danette a little fair warning that we'll probably have her talk in just a second here. But one of the things that I think is critical is understanding what could happen across the state. I think using Fremont as an example, there was a specific case, obviously, that caused that level of concern, and that case was known and roughly known what the potential exposures were in that particular setting. And I don't think that will be an unusual thing, unfortunately, that if we do have a very specific risk, there might be requests that schools think about being able to be part of the local partnership that figures out how to try to stop the spread of any of the coronavirus itself. And that's one of the rationales for potentially having school closures. The second rationale, that's a little more broad and probably a little harder to grasp, is our role in helping address the concerns that might happen in a general population of spread. And I'll start some of this conversation. I just want you to be aware of this in case we do see a somewhat unconnected general population spread of coronavirus. Certainly UNMC, our state health experts, are saying if you get to a certain population and about 1% of your population starts to exhibit coronavirus or this type of virus in general, or results from that, there's huge cause for concern in those cases. And part of the hard part is we just don't know how many people might be out there with coronavirus. And so far we've been lucky. I mean, the other states that have had community spread of the disease, that's when they don't know how someone got it. Those are things that cause level of concern about how quickly this could spread. And so part of our hope is to be part of that solution at a school and community level all across the state of Nebraska in case that comes to fruition. The other part of the reality is, as we run into specific cases, and again, this most recent Omaha case is a good one to learn from. It's really hard to know where people necessarily have been and who they've been in contact with without a lot of work. So as we start to see more of those cases, you can see how quickly that could spread. So one of the challenges for us, and I think the desire by health officials is to ensure that this is as slow and gradual a spread as possible, so as not to overwhelm our providers in the medical arena, and certainly in nursing homes and other places as well. And so I'll end with saying that in many cases, we're seeing that certainly school-age kids and school-age population and kind of younger population is not as impacted as older populations. That's at least what the somewhat of the conversation is. That's both good and bad. It's good in the sense that certainly we're less afraid for children of the state of Nebraska that aren't otherwise vulnerable, but we're probably more concerned about what that means for children spreading it to, perhaps their grandparents or other vulnerable people that they live around. And so I think you've heard those types of things before. We'll address some of these things. I'm going to turn it over to Danette Smith. We'll test out, make sure the technology is working for us, and we'll unmute her line and see if that works. So Danette, are you there?
I am. Can you hear me okay?
Yes, I can.
Okay, good afternoon, Matt, and to the folks on the call today. Thank you so much for having me. And I just want to take off where you left off at, Matt, and that is that the Department of Health and Human Services has forwarded to NDE some information about the virus and what you can do in the schools and in your child care programs. I want to underscore that if people are sick, they really, really need to stay home and not come into work or not come into school. Right now, having perfect attendance isn't important. Right now, we're trying to minimize the spread, and here's where schools can help us with that. On our fact sheet that we sent over to NDE, we give you a lot of information, again, of where you can find pertinent information. We have an up-to-date, real-time website at dhhs.ne.gov/virus. Please feel free to look at our website, but we also refer to the CDC as well, and we also have a specific website to our public health division as well. So I just want to call that out to your attention. So let's kind of talk a little bit about how we got here and kind of the communication moving forward. As you may be aware, there was a case of a lady who was a traveler, and that's what we're calling it, who traveled to Seattle and thought she had some symptoms. Luckily, she and her husband tested negative, and so that case is moved to the side. However, the case that you've been hearing a lot about is about a lady who had several visits to her medical provider, ultimately became ill, and on March 6th, she tested positive and was transferred from the Methodist Hospital in Omaha to the biocontainment unit there at the University of Nebraska. She did have some underlying health conditions that I think may have exacerbated this virus, and so, as you're aware, UNMC is working very closely with her. She also had been involved in Special Olympics that was held out at the YMCA, and this was out in Fremont. And so we've been working with the YMCA. We've also been working with the VFW that she attended an event there in Omaha. The Three Rivers and Douglas County are really handling all of the contacts, along with my EPI team, who I'm extremely proud of, have been handling all the phone calls and contacts that have been going on, I know, over the past weekend. And when we look at assessments, we look at it from three different areas. One is self-monitoring. That means that we want you to look at the symptoms. If you should have any symptoms, we want you to make sure that you're paying attention to your body, and if need be, move into self-quarantine. And self-quarantine means where you've actually been exposed. No symptoms right now, but you've actually been exposed, and we're asking you to self-quarantine. And again, with the monitoring and self-quarantine, we want you to be in contact with your public health provider. The very last one is self-isolation. Here's where you are actually having some symptoms and probably need the attention of medical care. We are suggesting that you contact your medical provider to make arrangements to be seen at a hospital for treatment. If you are self-quarantined, that means you must stay home. You must stay home. And you're looking at your symptoms to make sure and being in contact with your healthcare provider. I want to stress to you that one of the things that Matt shared with me was that many of you want to know how the communication is flowing. And again, if you are concerned, I want to recommend that you be in contact with your public health provider in your particular community. You can certainly reach out to DHHS, and we will try to answer your questions as best as possible. I have an excellent communications team, and I also have an excellent EPI team, as well as a preparedness team. And you can certainly reach out to my office, and we'll get you any information that you need. But the most important thing is information will be coming from the Department of Education, and probably from your local public health directors. We are meeting very frequently with your public health directors to make sure that the information that we have, we're disseminating it to the most appropriate people. You may also be aware that for the incidences that have happened in Fremont, my FE team is doing an excellent job with tracking all contacts from the young lady who has tested positive. And so that will help them kind of make decisions around who has been really affected, those that need to be monitored, and those that need to be self-quarantined. And so that is going on as we speak now. You may know nationally we've had approximately 19 deaths. There have been 16 deaths in the state of Washington, 2 in Florida, and 1 in California, and approximately 32 states, including ours, that have been affected by the virus. I would ask that if you have any questions for DHHS, if you would be so kind to give those questions to Matt and his team, we will coordinate a response back to you. Thanks, Matt.
So Danette, I'm gonna, just because I saw a question that I think you can help me with. One of the questions that I saw was, is the guidance right now is only those that were at that Special Olympics tournament need to self-quarantine, or other people
yes,
that were near that? Could you describe them for us? Yeah, thank you.
Yes, what I'd like to have happen is to please call your public health department, and they will tell you what you need to do. So that would be either Three Rivers or Douglas County. So,
and then Dana, before I'll let you go on that front, and then I've got a couple more things I can add. The experiences that we've seen with schools, obviously, again, as Danette mentioned, the importance of that coordination with the local health officials. There is, from on our website and through a couple of the conversations, links to the DHHS information that would help you identify who those folks are. I will be working again. That's kind of some of what I hope to work with the ESUs to also help expand everybody's understanding of who their local health officials are, and continue to communicate that. So I certainly welcome you to explore some of those resources, but we'll also try to help you find those and help you connect on those fronts as well. So thank you very much, Danette, for that input. I don't know if Dr. Antone has joined us yet, but if we find out that he does, I'll make sure that he has a chance to provide some feedback as well. I'm starting to see a couple questions that I'll be happy to respond to as at least as best I can right at this moment. One of the I think important things for us is trying to gather those questions. Again, I wanted to highlight the that contact form on our website for your questions, because that'll help us going forward and being able to move forward on that front. I just saw one pop up around AQuest and attendance. Is it going to affect attendance? And there's a lot of unknowns yet. I don't want to. Our reality is we're going to work on all those different types of questions. Probably have to worry by the end of the year what types of impacts we've had, and try to address that. One question we've gotten, I don't have it on here yet, is how we're going to deal with state assessment if we have a disruption. For those of you, and I can see Dan Endorf, those of you that dealt with flooding last year, at least I hope that those that experience things with the department, we try to get you the answers and address the challenges that you had, obviously, and it'll be the same thing in this case. I think for instance, Fremont was supposed to do ELPA 21 testing this week that they're calling off, and so obviously we're providing whatever flexibility they need on that front too. So we are watching other states and seeing how they're communicating with that. I think Washington right now is one of the kind of by necessity leaders in how things are being addressed. I've seen guidance that they've provided on very similar kinds of concerns and questions that we've had, and we will be both trying to anticipate those types of questions and address that. I see a couple questions I'll address quickly. One is the one that has popped up for everybody. Any thoughts to a centralized web page to keep track of school closures? And the answer is going to be yes on that. And again, Washington has a similar type of approach to that. Trying to share that will be important. That we'll have to address there. I also see a question about e-instruction and virtual learning. Here's what's interesting underneath the Nebraska law, or Rule 10 in particular. It doesn't necessarily give the department specific permission to just grant you whatever you want to do. But in the end, what I would say is we will consider all of that in mitigating factors to address a school year. One of the things I think about, and what I've been reading across the country too, in different guidance, you want to create a sense of normalcy for your students and families as best you can. I think there's going to be employment issues. I think there's going to be a lot of questions about who's making what decision and what given moment in time. I don't have all the answers for that yet, but we will be working with everyone addressing those questions and starting to put some of those questions at least in an appropriate way to go forward. I see a few more questions that I see a few questions, maybe things are coming out about specific things related to students' contact or something around Fremont cases. I'm going to encourage you, if you have those questions, to start to organize those a bit in the background, because I don't think I can appropriately address them here for you. I see a couple folks that have asked that type of question, and we'll try to work on that with you. And I think I'll double check, but I think as this is recorded, we get a recording of the group chat too. So, and then maybe kind of my couple other questions. I think I saw one about, what the school's routines might be around staffing, and if they're closed down, and how to best address that, and whether or not when people, if they are sick, whether or not they have enough sick leave. These are going to be pretty common questions also for us at the Department of Education, by the way, on how to deal with staffing if you are having to deal with self-quarantine and other fronts. And so, again, I'm not sure I can answer that question broadly just yet, but I will say to the extent that we can organize people to address that question, we will be doing that too. And then a great question is, we have to be, I see this one from Steve Grizzle out there somewhere. We have to be aware that if we need to close schools, kids and staff won't stay home. I think that is a really great point. Let me share one thought. And I had a conversation with the governor this morning on a similar type of topic of knowing if you have to broadly start to close schools, you don't want to do it neither too soon nor too late, right? The goal is to stop the spread of the virus. If we all decided, well, let's close them today, that would not would probably not help us slow down the virus, because people aren't going to stay home. They're going to still go out and about. They couldn't possibly, try to control that environment. I actually think in some ways staying in school is a part of the control too, right? That once we know of specific concerns around the spread of the virus, we will be able to identify those and hopefully address those. But to that broader point, if you shut down school and people just are going to go out within the community, it's not a control that we have from the school environment. So that's going to take some communication and work with local and state health officials as well. So thanks for that particular point. I think I can unmute Jay Beller if he's willing. I see a question. Can Dr. Beller weigh in on plans for the boys state tournament? And I know I talked to him just yesterday, but given how things work, I don't know if I know the latest on that, Jay. So I'm going to try to unmute you here and see if we can let you address that question, if willing anyway. I don't think we got you unmuted yet. Yeah, we're not having luck. He probably, that's a good no comment, I think. But we'll keep working on that. If we're able to come back to that, we will. Jay, do you see an unmute on your own side and see if that works? I don't. Oh, there we got it. Jay, can you try to see if it worked anyway?
Can you hear me?
Yep.
Okay. Yeah, as I spoke last night, Matt, and the NSA, we're going to try to go on with the state tournament if possible. And like we said, that can change daily. But at this point in time, we're going to plan on having the tournament. Now, we're going to work closely with NDA, of course, and the CDC and our medical experts, and would be vigilant to listen to them. But as of now, we're planning to go on.
Yeah, so thanks, Jay, for that. And I assume we'll help communicate if things change as well. So appreciate you being on today. So
thank you.
I see a couple more questions I'll try to address, and then I'm gonna actually have unmute in case Danette Smith has anything else to add. So a couple of questions I see, like the threshold of knowing when to get to that, I guess, a tipping point relative to the cases that we know whether closing a building is necessary. Number one, I think when there's a specific instance that's connected to that building, that's probably always going to be one tipping point given a specific instance. The other side of the equation, I think, is if and I was talking before, this notion of 1% of the population, it's hard to know exactly where that is without testing the whole population. So I think what's been indicated by the governor in my conversations with him, probably officials from UNMC, certainly with HHS, is looking at if we have community spread. So 2 cases within a given area, and if I was to use Omaha area as the example, 2 cases I think is what they believe, again, of community spread that wasn't related to travel or some other specific issue, then that's kind of the tipping point. And then the conversations, I believe, will start. I wonder if Danette has any comments on that if we have her unmuted. I don't know if she can hear on that front. So I hopefully I got that essentially addressed properly, and we'll keep addressing that question as well. Another great question I just see, if we get into that, how do we know if we're getting back out of that? I think that's, I'm uncertain of that right now, and how do we know when we turn that corner again? I think it's important. And then I see one from Brent Hollinger here. If closed, it could be closed for a long time. Yeah, I think that's the I think that's also the concern, that as it kind of spreads, that the amount of time that schools might have to be closed is important. So we have lots of different topics that might be important for the state to consider. I think it is quite a challenge. I see Dan. I'm getting text on the other side of this. So Dan Anton Smith says she's still on. So maybe Dr. Anton is available. So maybe
I just joined. Dr. Boone.
All right. Sure. So thanks for joining.
Just off a call with the governor, and I just heard your last few minutes of what you were saying there, and that still is the guidelines right now is 2 cases of community spread before declaring closures of public events, things of that nature, and public events would qualify as anything greater than 10 to 20 people in one gathering. So right now we don't have 2 cases of community spread, as everybody knows, but that's still the threshold that we're hearing from the governor's office.
Yeah, so thank you for that. I've got a text from Mark Shepard, and Mark, are you? Well, I'm not sure how you're dialed in. I want to make sure we can unmute you if need be here. So we'll look to find Mark somehow in the list. So here's I think that's 402. So we'll find Mark on that. It'll be nice to have him take a couple thoughts, questions.
Matt, I think
Mark,
I'm unmuted now.
Yep, you are, Mark. Thank you.
Okay, so just a couple of quick things. I've had a lot of questions from superintendents about, how our decision was made, why our decision was made. And I think the important thing to point out is the decision was not made in a vacuum. It was made working very closely with Three Rivers, working closely with DHHS, the governor's office, and others. The situation in Fremont was somewhat unique in that we were 3 days away from our spring break. In our discussion in a teleconference, it became clear that they were really trying to get to the 14th, which would be the incubation period for those that may have been exposed at the event at the Fremont YMCA. And given that we would only miss 3 days of school to get to that point, and then from that point have another full week off of spring break, we just felt that that was the prudent thing to do. And that was confirmed by the state epidemiologist and also Dr. Anton. So that's kind of the background on the decision. It was a little bit different than maybe a decision of someone who attended the event. You only have 1 or 2 individuals that were at that event that are now back in your schools or in the personal quarantine.
Yeah. So thanks for that, Mark. Do you have anything else that you want? I don't know if you're one thing, Mark, I guess, because you and I talked about it, I'll just raise it, and that is, I think you said you maybe as folks are asking, is this really that serious? And I think I can reiterate the impacts of this data I was looking at today. It's much more serious than the regular flu. I mean, and they think actually more contagious than that 1918 flu epidemic. And so the danger is, I think, very real for our communities.
I think, Matt, one of the pieces that we looked at and that was forwarded to us by one of the health professionals was an LA Times article. If you haven't seen it, if you can get a copy of it, it's very good. It just talks about basically the comparison between the flu and COVID-19 or coronavirus. And what it really outlines is the unknowns related to coronavirus and the fact that there isn't a vaccine, there isn't really any specific medication for dealing with it. And it also talks about the way it potentially could be spread. So I think if individuals have not seen that, Matt, maybe you could post that. I think I sent you a link to it on your website. Keep in mind, it's a news story. It's not coming directly from any public health agency or anything like that. But what I found comfort in is the fact that it used a lot of terminology that I understood and that others that are not in the medical community would understand. we've used it within our own community to share out so that people that ask that question, why is this such a big deal? It's got a lower incidence of death right now than influenza A or influenza B, which are both accurate. However, when you read that article, it gives you a better perspective on what the precautions are and why they need to be in place.
Yeah, my understanding of why that is because obviously it's a novel virus, which means the genetic sequence has never been entered. I was just going to add to that the reason that it does have a more serious effect than the regular flu is because nobody has immunity and nobody's been vaccinated. So it causes much more of a problem. Even if vaccinations only work 50% of the time, it still slows down the spread considerably by doing that. And that's the reason for doing these non-pharmaceutical interventions are to try to act like a vaccine and just slowing the spread by decreasing the number of people that will be infected. But that's my understanding of why it's more serious than just a regular influenza, is because it's a brand new genetic sequence or flu virus that nobody has any immunity to.
Yeah, I think that's a very good point. So, hey, Mark, I muted you. I'm going to unmute you in case you had anything else.
That's really all I have for now. I think the importance is as has already been stated, you work directly with your local health authorities as well as your private and parochial schools. And if you have community college or university within your community, make sure you include them as well, because bottom line is we're all in it together. We also have the city, the mayor, and city officials involved, because it is a citywide issue, not just a school issue at that point.
Yeah. Well, thank you very much, Mark, and appreciate your ongoing leadership on this. So thank you. There kind of an area that I think I kind of want to kind of wrap up on a little bit is, and with Dr. Anton on, I think in particular, I see a couple questions out there about the indication of when we have kind of turned a threshold of the spread within the community. And I think one of the questions, and I'm not asking you to answer this question per se, but are we looking at that from a statewide level, a regional level? Obviously, our state borders a few other states, and whether or not how we should be thinking about that, or at least beginning to discuss that, at least among school officials and health officials. Do you have any guidance for us on that at this point?
Yeah, we discussed that at the governor's call just now, and it would be at the regional level.
And are you thinking local health regions?
Yes. Yeah.
Okay.
So like if we had something happen here in Omaha or Lincoln or Fremont, that might not affect Scotts Bluff or more Western communities.
Okay. Well, I appreciate that. That's good clarifying information, and we'll keep working on ways to address that. I see a couple more questions I'm willing to take, and then what I'm going to encourage is folks to, because I'm probably missed some as we went anyway, but encourage folks to fill out that contact form with questions. We'll be spending time this week getting those organized and being able to keep that ahead of this. By the way, just because this one popped up, I'm sorry, we actually had a limitation on the Zoom call. We'll fix that for next week. So invite your friends, I guess, next week. Sorry about that limitation. Anyway, there's like different questions around, are there populations of kids that might be more vulnerable, and should they be encouraged to stay home? I think that's a question I'd rather kind of wait until we can kind of get that answered by local health officials. But I do think one of the things we're getting at the department are calls from parents asking about certain conditions of their kids. Obviously, if any parent has a concern about their individual student, I mean, we're encouraging them to obviously work with their school, but also encouraging you to address or to kind of walk them through. I mean, if there's a child with medically fragile or respiratory issues or something else that they want to ensure their safety, that's one of those things too. So,
As far as Matt, am I unmuted?
Yeah, you are unmuted. Yep.
Yeah. So the good news is that there's been no fatalities in any children, even in China, for any age group less than age 10, and only one fatality in a age group between 10 and 20. And you're right, it was in a compromised patient with cystic fibrosis. So if something like that, they might be a little bit more at risk. But even that being said, for some reason, it's not affecting children or even early adolescents like it is adults. And but unless they are immunocompromised on chemotherapy or something like that, that would be something you'd have to really consider. But the reason for closure of schools, again, I'm sure you probably went over this, Matt, is not for the children's sake, it's for their parents and grandparents' sake more than anything. So I think I used that example of when I talked to you early today when my 8-year-old grandson was asking, he was worried about the coronavirus. And I told him, well, you can not be so anxious about it because it's really not going to affect children and early adolescents, only older people. And that's when he said, well, now I'm worried about you. So I don't know if that meant he was thinking I was old or whether he was really worried about me. But anyway, that's the thinking about closure of schools.
Yeah. Well, I just want to kind of wrap up and say a couple kind of closing thoughts. Thanks to both Danette and Dr. Antone as well. Thanks to all of you for coming on. I'm actually seeing people are putting up resources on the chat, so I know there's a lot of folks with resources to be able to share. We'll keep kind of working on that particular front. I will be, like, just to mention, I'll be working with ESUs and others as we try to do this going forward, and having those conversations. We'll keep in contact with all the rest of the appropriate state officials. I just really encourage you to familiarize yourself with any of your other local officials. If you haven't been used to doing that. I saw questions that I know are specific to school districts about concerns about whether or not they've been in contact with other places. I think especially as it relates around Fremont, we probably take those questions a little more specifically and try to get you answers on that. So I just thank everyone for their attention. We'll do this every Sunday. We'll make sure we have a presence that can take the demand going forward. Here, a question. I'm going to answer this one just because I think it's the perfect kind of thing to end on, and it was similar to what we had before, asking about whether or not, as we close down schools, aren't our kids just going to go to theaters and other places that is going to have some type of potential spread? I have no idea if anybody watched kind of any international news with Italy, and you actually see that in northern Italy, they are going to extreme measures to try to contain the spread of the virus. Part of the reason for our measures right now is to try to control the spread, so it's not getting to that point where pretty much society is getting shut down. My hope is that through some communication, we can actually help contain this as best possible, and in Nebraska and in the United States as well. And that's our work ahead. I think we have lots of concerns. Everybody has family members probably that they can identify right off the top of their head that they might have concerns about. I think our best and most prudent efforts are to have these conversations. So thank you for joining. We'll do this again next week. There was a question about this will be recorded. I'm not quite sure how we're going to make it available for everyone, but we will find a way to do that and continue to do that so folks can review this. So thanks so much. We will be in further touch, and as I've joked before, I had a few superintendents who called and kind of asked, well, what should we do? What do you want us to do? Tell us what to do. And I said, well, it's funny because superintendents don't normally call me and say, tell me what to do. So that's not always what you're looking for, but I hope what we can provide is some leadership, and we can do that together. So thanks very much. We'll certainly, if not sooner, communicate next week as well. So take care.